they must sit in front and look forward, or they can lie down. And if they are sitting on a scooter and all, they should be strapped to the mother and not look at the movement. कळ्ळें? तरी पण अशें जाता जाल्यार वखदां मेळटा. You can meet your pediatrician. They will give you a medicine for motion sickness, and home medicine ginger is very good for motion sickness. So ginger sweet or ginger सुकलेल्या you get preserved ginger म्हणून मेळटा. That is good.
म्हणजे जिंजर म्हणजे आले.
आले.
करेक्ट. सो आले दिल्यार म्हणजे एक होम रेमेडी म्हणून ट्राय करता. तशें म्हणजे वखदां आसतात तरी पण जशें मॅडमीन सांगलां तशें पण तुमच्या पेडियाट्रिशियनचो सल्लो घेतल्यार यू कॅन बी assess.
And the tip not to look at the side where the image is moving very fast.
बरोबर सायडीकडे अशे इमेजीस मूव तशें त्या जाग्यार बसप ना. थर्ड.
Yeah. So one thing is to treat.
सवय जाता ह्या जाग्यार पाविल्ल्या.
Correct. So what happens is when you give the inhaler therapy, आमी जे वखद दिता न्ही ते आमी मिलीग्राम्सान दिता. पण in the inhaler आमी मायक्रोग्राम्सान दिता. म्हणून ते खूब कमी दिता डोस. So side effects खूब कमी आसा. And ते भायर आमी डायरेक्टली टार्गेट ऑर्गन मीन्स डायरेक्टली इंटू द लंग्स आमी दिता. समज शरॉप दिल्यार ते पोटान वयता, लिवरान ब्रेकडावन जाता, मागीर ते लंग्सान पावता.
म्हणजे तो लॉंग पाथवे आसा तो कट जावन एक डायरेक्ट टार्गेट आसा थंयच अटॅक करता.
सो द डिलिव्हरी इट इज बेटर. लोक समजून घेता की चड सिरियस जाले म्हणून हे सुरू केला. सो इन फॅक्ट इट इज दोज हू कॅन अफोर्ड वी गिव दिस बेटर वे ऑफ delivering the drug. But besides this also you can avoid certain triggers. You know, what can the parents do? Actually cold air is a trigger. Other thing is like dust mite. So in the house actually extra curtains should be washed frequently. अशे चादर बी सगळे वताक दवरून जाय, or wash in hot water because of dust mite. मागीर animal fur. So animal pets should be avoided as far as possible. So these are the precautions they can take to identify triggers. Kedna ashe Diwali, when there are a lot of crackers and all, they should not take the child out. If anyone is smoking in the house, that should be avoided. So smoke, crackers.
So trigger factors ते जर अवॉइड करून ट्राय करपाक हरकत ना. डॉक्टर एक प्रश्न आयला असतो तो घ्या. हॅलो. हां.
हॅलो.
हां विचारात.
दोतर म्हजी चली न्ही 7 वर्साची आसा आनी ताजे न्ही दात किडले आनी बारीक कुसां अशी उरल्या आनी ताका आतां नवीन दात येवपा ते त्रास जाता म्हणून ते आमी कुसां काडून घेवपा जाय.
ओके द क्वेश्चन इज कितें जाता न्ही ते अशें कुसां उरल्यार डेंजर कितें जाता की इन्फेक्शन तितून आसा जाल्यार इट विल इन्फेक्ट द टीथ अंडरनीथ द परमनंट टूथ
which is on the way.
On the way. So this, if it cannot be treated with root canal or filling, it should be removed.
So best म्हणजे तुम्ही तुमच्या डेंटिस्टाचो सल्लो घेयात, ताचो ओपिनियन घेयात आणि त्या प्रमाणे म्हाका दिसता जे लायन ऑफ ट्रीटमेंट आसा ती फॉलो केल्यार तुमकां खूब हेल्प जातली. डॉक्टर आमकां एक फुडलो प्रश्न आसा. हॅलो. हां विचारात.
म्हाका प्रश्न विचारपाचो आसलो की इम्युनायझेशन कितलें गरजेचें. म्हणजे आमच्या शेजारी एक भुरगो आसा ताका भुरगेपणांतल्यान इम्युनायझेशन जावूंकूच ना. फक्त जे भुरगे जातकच एक इंजेक्शन जे दिता तितलेंच दिलां. ताचे उपरांत तो आतां 5 वर्साचो आसा. ताका कितें गरजेचें आसतलें आनी कित्याक इम्पॉर्टंट तें, कित्याक ताच्या आवय बापायक कळना कितें सांगत जालें. सो तुमी हाजेर मातशें कितें उलयल्यार.
बेसिकली म्हणजे आय एम शॉक की अशे भुरगे गोंयान आसात जांकां इम्युनायझेशनूच जावना. इज रियली स्ट्रेंज. म्हणजे खरें म्हणजे आमी जेन्ना क्लेम करता गोंय इज वन ऑफ द टॉप मोस्ट स्टेट्स, अशी परिस्थिती आसा म्हाका आयकूनच खरो म्हणजे धक्को बसलो. तरी पण मॅडम यू कॅन एडवाइस बिकॉज नाव द चाइल्ड इज ऑलरेडी 5 years.
What happens is आमी जे दिवंक ना we can give as catch-up immunization. Now BCG we will not give because he must have got natural immunity. But DPT we will give 1 dose. Then we will give hepatitis. So whatever je miss kala, measles we will give all the immunization. So if a child comes to my OPD, I will give measles, I will give Japanese encephalitis, I will give one DPT and I will give oral polio.
सो व्हॉटएव्हर एक्चुअली म्हणजे बेसिकली जे ताका मिस जाला ते सगळे तुम्ही फ्रिक्वेन्सी म्हणजे मातशे टाइम मेंटेन करून दितली
आणि डोस मातशे कमी
तुम्ही तांकां एडवाइस दियात आणि तुमच्या लागींच्या गव्हर्नमेंट हॉस्पिटलान व्हरात आणि ते मातशे म्हणजे तांचे ते डोस करून घेयात.
बरोबर. That's what's called catch-up immunization. So even if adolescents come, if they have missed कितें जाता आवय बापूय फर्स्ट इयर आनी सारके सगळे आसा, they give everything well. 1.5 year मातशें लेट येता 5 वर्सां they have lost the card.
करेक्ट
कळ्ळें So then we write on a paper and we keep it. And then but 10 years dose काढूच ना.
कार्डच ना.
So we give catch up. So if they have missed anything, we give Tdap or we give TT or whatever, and we see that MMR doses, 2 shots are given. Encephalitis up to 15 years if they have missed. So whatever is missed, we let the child catch up and we give the immunization.
स्पेशली एक समज आसा म्हणजे इवन जे शिकले सवले लोकां मदीं जो समज आसा की जर तुमी ताका तो इनहेलर दिलो जाल्यार ताका संवय जातली. परहॅप्स दीस इनहेलर्स आर म्हणजे लूक एज अनवॉन्टेड थिंग्स दो दे आर सपोज टू बी गुड. हाचे विशीं मातशें विस्तारान सांगताले तुमी.
They are good म्हणजे आमी कमी डोस दिता and the side effects are less and we want to prevent the disease on taking on a chronic form. So that is why we advise inhaler therapy and we then review the patient every 15 days and by 3 months we decide step up करचे पडटा dose or step down. So within a year we the dose goes up or down and most patients respond and they don't have to take this thing lifelong.
Yeah. The most common apprehension is that भुरग्याक आयुष्यभर घेवचे पडटले सवय जातली आणि that's why they always want to keep these inhalers
So it is
away.
known that by 10 years about 75% of people will remit. They will be controlled their asthma and most of them those who wheeze below 5 years and अशे थंडी जावन अशे wheezing जाता these are the people who it is more likely to disappear. But those who wheeze without any cold or who have got family history of wheezing in one of the parents or who have had atopy or eczema in the early childhood, these are the people who are likely to present as asthma. And if there is one thing that you can do to prevent your child from getting asthma, your next child from getting asthma, that is breastfeeding. So those parents, we tell them, you breastfeed as long as possible to prevent your child from getting asthma.
Okay. Before we go to breastfeeding, I'll ask you one important question. What's a tricky question असा की usually we recommend की घर सगळ्यांनी वर दवरपा जाय, साफ दवरपा जाय. And in fact, there are a lot of parents, they put different chemicals to see that the house is kept clean and very systematic, hygienic to be more precise. But they say like these are the children when they go out, they are exposed to the external environment, which you cannot is not under your control.
Yes, that's right.
And these are the children more prone for getting asthma. This is one of the articles said. So
Yeah, that is true. In fact, indoor pollutants is one of the causes for the upsurge in asthma. So this is exactly sprays, indoor pollutants and keeping everything very clean. In fact, there's a hygiene theory where they want to make a vaccine of different organisms to stimulate the other pathway rather than this alternative pathway that asthma has taken.
Yeah.
So it is exactly what you said, that this is the cause of increase in incidence of asthma. But where wheezing is concerned, everything that wheezes is not asthma. So parents need to know very often it might be adenoids, it may be sinusitis, it may be polyps, it may be something in the upper airway that can be the cause of wheezing. And sudden onset of wheezing can be a foreign body. So if you get wheezing in a child who suddenly starts and you get findings, the doctor examines at only one side, then we have to rule out a foreign body. Children like to put rubber, they play with beads. And these are the things that we commonly find that can go in the airway and block it and can cause wheezing.
Another question.
Yes.
A little tricky. There was another article saying that let the child eat clay. And perhaps, I don't remember exactly, but the author may be hinting towards the child will get more probiotics and whatever. Is there anything you recommend or what is
we are not in that stage to say let the child eat clay because people may throw clay at us. But the basis of this is exactly what we said. It's the hygiene theory. Expose the gut to different environments.
Indirectly.
Yeah. Like they say in a child with asthma or for the next pregnancy, one is early breastfeeding, is do a vaginal delivery rather than go for cesarean. Because they want the child to be exposed to all this
environment.
Exactly.
Absolutely.
Yeah.
And in fact, I would like to add, these are the days most of the ladies, they want cesarean because they don't want the pain. Maka duktale, maka te jauche na, Dotor cesarean kar. This is their first choice. In fact, doctor is also, I am not saying waiting for, but doctor will be happy.
No, but they do counsel them about the advantage.
Especially in government hospital. So now let's come to another tricky area and where I want you to throw light as an expert is breastfeeding right from zero station.
Okay.
I want your comments right from zero station. Yes.
Okay. I'm happy to talk about breastfeeding
Yeah.
because it's one of the areas I like to work in.
Yeah. In short, because I
Yeah.
think we have got another 3 minutes.
Okay,
Yeah.
the breastfeeding is in our hospital, we start as early as possible. And when I say this, it is even before the cord is cut. You know,
Oh.
I mean, sorry, not the cord is cut, before the placenta is delivered. So the baby is born, the
Yeah.
cord is cut,
Cut.
and we put the baby onto the breast in what is called a breast crawl,
Yeah.
where we allow
This
the
I think
baby.
most of our doctors also should listen very carefully because they are the people who propagate na आता ते glucose उदकला हेला and this is a wrong practice, absolutely wrong practice.
I fully agree with you. It is criminal to put, you know, glucose water or something else, because in that you're giving the lining of the intestine a completely dangerous thing. You can
Situation.
put bacteria and all sorts of things.
Yeah.
While if you give breast milk to line, the first thing that enters the baby, the secretory IgA, it lines the whole intestine and the baby is now ready to fight infections. So what we do is, as soon as the baby is born, the cord is cut. Even before the
Placenta is delivered.
baby is put on the mother's abdomen and the baby crawls towards the breast. You can just Google breast crawl and you'll see what a beautiful thing it is. But again, there's little opposition from obstetricians and all, because they are afraid that, you know, will the baby fall, will the baby so we sometimes, you know, just assist the baby to go a little faster to the breast. But it's a wonderful thing to see the baby going there, because no animal takes their baby and puts them in a stream to clean them. So the thing of giving the baby bath and cleaning them first is a very unnatural thing. But it's the best thing would be to have the mother and the baby together as close as possible. So skin to skin, without putting any clothes on the baby, just a cloth over, the baby crawls and the baby takes the breast milk. So it's within a minute after birth, but this we do only in babies who are normal and who have cried vigorously at birth, which happens in 95% of all deliveries.
Okay.
So just 5% who will not be able to do this.
And up to how long? Because now we are almost finishing. How long the breastfeeding should be continued?
Breastfeeding should be continued for 6 months exclusively, and then you should continue for as long as possible. And when people ask me how long, I say continue, but stop before he goes to college.
ओके फायन डॉक्टर आयच्या काळात तुम्ही बरीच मोलादीक माहिती दिली. सगळे जे आमचे आयकुपी आसा तांच्या वतीन आय मस्ट थँक यू. देव बरें करूं, काळजानसून देव बरें करूं. तुम्ही सगळे जे कार्यक्रम पळयताले तुमकांय काळजानसून देव बरें करूं. दुसरे फावटी आमचे बरोबर आसतले डॉक्टर शैलेश कामत, गोंयचे नामनेचे युरोलॉजिस्ट. ती कार्यावळ पळोवपाक विसरूं नाकात. तो म्हणसर तुमकां सगळ्यांक काळजानसून देव बरें करूं. नमस्कार.